Hi guys, good evening. I hope you did well in the exam. So this is Dr. Pritesh Singh, your surgery faculty. The questions discussed in this PPT are recall based, and the motive of this live session is to get the actual questions asked in the exam. The final questions received will be uploaded on the PrepLadder app ASAP. So guys, let's start. First question, in indirect inguinal hernia surgery, which nerve is most commonly injured? Tell me. Sarwan, Mindset, Ishra Khan, Depinder, Pooja, Shivani Malik, Naman. Okay. So guys, you know that whenever we are going to perform surgery for indirect inguinal hernia, most commonly injured nerve, that is ilioinguinal. Most commonly injured nerve, it is ilioinguinal. And if it is laparoscopic hernia repair, in laparoscopic hernia repair, the most commonly injured nerve, that is lateral cutaneous nerve of thigh. So in open hernia repair, it is ilioinguinal nerve, and in laparoscopic hernia repair, it is lateral cutaneous nerve of thigh. Clear? So guys, correct answer is D, ilioinguinal nerve. Ritesh, Arya Singh, Dipinder, Dr. Rafa, everybody is correct. Guys, so here it is ilioinguinal nerve. Okay. Next, what is the most common cancer in females in India? Guys, tell me what's the correct answer. Most common cancer in females. Most common cancer in females in India. Yes, Sarwan, very good. Soumyadeep, Keshvi, Paneer Selvam, Kuldeep, Aisha Khan. Majority of you are correct, guys. Hina Khan was also having this cancer. That's why this question was asked. What is the correct answer? Carcinoma breast. Is the breast cancer. Most common cancer in females in India, that is breast cancer. Clear, guys? Next, identify the cause of the given condition. First, see the image. What is this? Can you see what's the problem here? How many bubbles can you see in this image? Guys, tell me. How many bubbles can you see? Guys, can you tell me how many bubbles you can see? Yes? Triple bubble. Okay? Triple bubble. So, you know that this triple bubble sign, it is seen in which condition? Triple bubble, it is seen in guys, yes, okay. So there was one option, jejunal atresia. There was one option, jejunal atresia. So some students told me that one option was jejunal atresia, and that's the correct answer. So what? It's the jejunal atresia. Jejunal atresia. Clear? So jejunal atresia. There was another question related to perforation peritonitis. And in perforation peritonitis, there was gas under right dome of diaphragm. Can anybody remember? Anybody remember that question? Yes, there was free gas under right dome of diaphragm. That was hollow viscous perforation. So there was another question. What? Another question was there, and there was free gas under right dome of diaphragm. So there was free gas under right dome of diaphragm. That was pneumoperitoneum. Free gas under right dome of diaphragm. That was pneumoperitoneum. Clear? And what was the diagnosis? Obviously, that was visceral perforation or hollow visceral perforation, hollow viscous perforation or visceral perforation. Monu, are you from RML? Yes, I did my post graduation from Lady Harding and I was posted in RML. Monu. Okay. Guys, there was another question somebody told me that there was image of perforation. The bowel was there and in the bowel there was one perforation. Anybody remembers that question? There was one image. Image in that image there was perforation in the bowel. Yes. Generally, that kind of single perforation is seen in ileum in patients who are suffering from enteric fever or typhoid. So in typhoid also you will find ileal perforation. Anybody remembers that question? Yes. Okay. Alcoholic man with bowel perforation. Small hole in the bowel. Right. Okay, guys. So here it is hollow viscous perforation, and second, if triple bubble appearance is there, the triple bubble appearance it is seen in jejunal atresia. Clear? Next, can you tell me what is the correct answer here? Guys, tell me what is the type of skin graft used in this image? You can see here. What's the kind of skin graft? It's a not. Let's rule out. Obviously, it's not a flap. What are the types of skin graft? It is split thickness and full thickness. Split thickness and full thickness. Yes. So guys, this is split thickness skin grafting, and some student told me that sir, Thier's skin grafting was also there. So it is also known as STSG, split thickness skin grafting, that is also known as Thier's. Split thickness skin grafting, that is known as Thier's, and there is full thickness skin grafting. Can you tell me what's the name? Full thickness skin grafting, it is also known as Wolf's. So full thickness skin grafting, that is known as Wolf's. Thier's, that is split thickness skin grafting, right? Okay, myocutaneous flap was there. Okay, this is obviously not the myocutaneous flap. So there was one option, what? Myocutaneous flap. One option was myocutaneous flap. Okay, right. There was one option, cover with omentum in small hole question. Okay, so I got it. Sometimes this kind of question might be there. Suppose this is the duodenum, and in the duodenum anteriorly, what happens? There is perforation. So this is duodenal ulcer perforation, guys. Suppose there is duodenal ulcer perforation. In this duodenal ulcer perforation, we go for what? Omental patch repair. So if there is duodenal ulcer perforation, the patients who are having duodenal ulcer perforation, in duodenal ulcer perforation, we go for omental patch repair, guys. So duodenal ulcer perforation, what's the treatment? Omental patch repair. We go for omental patch repair. And what is the other name of this omental patch repair? This is also known as what? Modified Graham's repair. So omental patch repair, yes, it was, yes, Naman Krishna, that is Manish Sharma, that is modified Graham's repair, guys. Modified Graham's repair. So I got the question. Modified Graham's repair. Clear? So it was omental patch repair, and there is a single perforation where? Anteriorly in the first part of duodenum, and we go for what? We go for omental patch repair, that is also known as modified Graham's repair. Clear, guys? Okay. So next question. What is the common incision used for appendectomy? It's easy question, guys. Can you tell me? It's easy question. Okay. Arun, very good. Soumyadeep, Rishi, very good. Very good. Omental patch was there. Modified Graham's repair. So I hope everybody marked correctly, right? Next, what is the common incision used for appendectomy? Let's rule out. Cocker's incision, this is for open cholecystectomy. Midline incision for laparotomy. Clear? So what is the correct answer? Battle's incision, obviously it's not used for appendectomy. We use McBurney incision, also known as MacArthur incision, also known as gridiron incision. So what is the name of incision used for appendectomy? It is McBurney incision. It is McBurney incision. Okay, Sai wants to say that, sir, McBurney nahi tha. Gridiron was there. Gridiron, okay. So McBurney incision was not there. It was not there. The other name is gridiron. The other name is gridiron. Okay, so McBurney was not there. Gridiron was there. So McBurney was not there in the option. It was gridiron. So correct answer, guys. Correct answer is gridiron. Clear? It's the gridiron incision, right? Next, when I took the interview of some students, just outside the examination hall, just outside, and students were telling that they were very happy with surgery questions and gynae questions, and they told me that lots of questions were asked from surgery and gynae. So guys, I hope you remember those questions. Many questions were from surgery in the form of image based questions. Clear? So lots of students were happy also. Okay, next, easy question, guys, again, and students were telling me that, sir, previously year means the topics were repeated, there was options which were jumbled, options were new, but the topics were same, right? So see, guys, okay, Himanshu wants to say that, sir, the questions of surgery was not very easy, right? Guys, see this. A patient following road traffic accident presented with subcutaneous emphysema. On auscultation, no air entry. On the right side, there is no air entry. Why there is no air entry? Obviously, the lung is collapsed. Why lung is collapsed? Can you see? There is subcutaneous emphysema. What happens? Because of road traffic accident, there might be rib fracture. There is subcutaneous emphysema. So, chances are that patient is having tension pneumothorax because there is no air entry on right side. And whenever you suspect tension pneumothorax, what's the immediate next best step? Guys, tell me what's the correct answer? Okay, it was hyper. E fast was not there. Okay, what were the options, guys? E fast was not there. It was hyper resonant. Okay, so obviously, guys, you know that if you suspect tension pneumothorax only on the basis of suspicion, because diagnosis of tension pneumothorax, it's clinical. Diagnosis of, you know that the diagnosis of tension pneumothorax, it's clinical. It's a clinical diagnosis. On the basis of suspicion only, put a wide bore needle in second intercostal space in mid-clavicular line in children and in fifth intercostal space in anterior axillary line in adults. Clear? So what? Insertion of wide bore needle. What we do? Insertion of wide bore needle in fifth intercostal space. Here, wide bore needle compression and IV fluids, intubation and positive pressure ventilation. The first is what? Insertion of wide bore needle in fifth intercostal space. Needle thoracostomy. Okay, the same. Wide bore needle, this is also known as what? Needle thoracostomy. This is needle thoracostomy. Somebody wants to say that, sir, it was needle thoracostomy. So obviously it was needle thoracostomy. Okay, one option was in the fourth intercostal space. No, fourth intercostal space. No, we are going to insert it in fifth intercostal space. And one option was tracheostomy. Obviously, we are not going to do tracheostomy. One option was tracheostomy. Intubation option was not there. Okay, intubation option was not there. One was tracheostomy. One was in fourth intercostal space. Okay, clear? So guys, obviously correct answer is A. Very good. Next, a patient underwent bronchoscopy. During procedure, perforation occurred at 25 centimeter from incisor. Which structure is likely to be damaged? Right? Now see guys, from upper incisor, what are the locations of structure? It is 15, 25, 40. At 15 centimeter, there is cricopharynx. At 15, there is cricopharynx. Clear? At 25, it is arch of aorta and left bronchus. And at 40, it is diaphragm. So how to remember? It is bald. B means beginning. Beginning of esophagus, that is cricopharynx. A means arch of aorta. L means left bronchus. That is from 25 centimeter of upper incisor. And 40 centimeter, it's diaphragm, opening in the diaphragm. Clear? So guys, what is the correct answer? Obviously, it is arch of aorta. It is arch of aorta. Okay, so MS, Sai, Naman, it is arch of aorta. Clear guys? So at 25, it is arch of aorta, left bronchus. At 15 centimeter, it is cricopharynx. B means beginning of esophagus, that is cricopharynx, and 40 centimeter, that is diaphragm. Clear? Okay, one option was right bronchus. Okay, so one option was right bronchus. It's not right bronchus, guys. It is left bronchus. Arch of aorta or left bronchus. Clear? So majority of you are correct, guys. Majority is correct. Next, during excision of ranula, another repeat question we discussed many times. During excision of ranula along with sublingual gland, which structure is most likely to be injured? Guys, tell me. Sublingual gland, which structure is most likely to be injured? Somebody is saying that, sir, this question was not there. Guys, tell me, this question was there or not? No such question? Okay. This kind of question was there, that during submandibular gland excision, which nerve is injured? Was there any question related to salivary gland? Was there any question related to salivary gland? Okay. No question. By the way, guys, whenever it is in relation to sublingual gland, here, what chances are that lingual nerve is injured? Usually the question which is asked, it is submandibular gland related. So whenever you are going to perform surgery related to submandibular gland, most commonly injured nerve, that is lingual followed by hypoglossal. Lingual followed by hypoglossal. Okay, so this question was not there. Let's skip it. Next question. A patient presented to OPD with dilated tortuous leg vein with history of trauma 10 years back. Can you see, guys? Dilated tortuous leg vein with history of trauma 10 years back. There is pulsatile vein and it's also visible. What's the likely diagnosis? Guys, first tell me, this question was there or not? Guys, this question was there or not? Dilated tortuous leg vein with history of trauma? Yes. Pulsatile vein. Guys, be careful. It is not varicose vein. It is pulsatile. Yes, very good. If it is pulsatile, obviously there is connection between artery and vein. History of trauma is there. It means obviously what is this? This is AV fistula. Guys, this is AV fistula, arteriovenous fistula. And in arteriovenous fistula, what's the problem? There is arterialization of vein. So vein become dilated, tortuous and thickened, and there is pulsation. Guys, so what's the correct answer? It's AV fistula. It is not varicose vein, it is not angiofibroma, hemangioma. Yes. Correct answer, AV fistula. Somebody wants to say that there was one question with needle cricothyroidotomy. Guys, can you tell me what was the question related to needle cricothyroidotomy? Needle cricothyroidotomy. Somebody is saying that it was image based question. Gauss piece, you want to say that there was image based question? There was one question related to sternocleidomastoid and level of lymph node involvement and lower lip involvement. Okay, guys, please, if you remember, please tell me what was the question related to that sternocleidomastoid muscle with lymph node involvement, and there was one question with lower lip involvement. Lower lip involvement. Yes, thyroglossal cyst question is coming. Next question, guys. Identify the type of ulcer. The same image was there or some other image was there? Guys, tell me. The same image was there or some other image was there? Obviously, this is not arterial ulcer, not the venous ulcer. Two options, diabetic ulcer. Yes, it can be. Atrophic ulcer was there or trophic ulcer? Guys, in the option, there was atrophic ulcer or trophic ulcer. So, guys, it's typical location, one of the typical location of trophic ulcer. It is not the atrophic ulcer, it's a typical location of trophic ulcer. Trophic ulcer. Clear? If there is diabetic food, what you are going to find the evidence of infection. So there might be pus collection. Yes, there might be presence of slough. So it is trophic ulcer, right? And let me tell you, the same image was asked many times in FMGE and NEET PG. The question related to trophic ulcer. So there is a big hole, and obviously it is located at the pressure point. Can you see pressure point? This is heel, one of the common location of trophic ulcer. Okay, so correct answer is trophic ulcer. Now, guys, can you see what is the diagnosis of the given image and next investigation required? So you can see what the same image was there or some other image was there. Reddish mucosal plaque. Can you see here, guys? It's reddish mucosal plaque. What is this reddish mucosal plaque? Obviously, this is erythroplakia. So this is reddish mucosal plaque. This is erythroplakia. And whenever you see erythroplakia, there is high risk of malignancy. Obviously, we have to confirm it with biopsy. So we have to go for biopsy. Obviously, what's the correct answer here? Erythroplakia. So go for biopsy. We have to confirm the diagnosis. So we have to go for the biopsy. Clear? The same options were there, guys, or you want to change the options? The same options were there. Okay. In AV fistula, one option was pseudoaneurysm. Very good. So one option was pseudoaneurysm in AV fistula. Okay, same. Yes, in AV fistula, I remember in AV fistula, one option was pseudoaneurysm. Pseudoaneurysm, obviously, pseudoaneurysm is present in artery, not in the vein. Clear? Next. Guys, see this. This is the typical image of, can you see the waxy appearance? It's a typical image of, can you tell me what's the correct answer? Young adult presented to OPD with complaints of mass in the testes. Orchidectomy was performed. What is the best prognosis? Which of the following has best prognosis? Guys, tell me. Best prognosis. There was a child with red mass on the back, squamous cell carcinoma. Okay. There was a child with mass in back. Mass in back. Squamous cell carcinoma. Okay, guys, now see. There is a trick in the question. Suppose the question is like this. If the question is that young adult presented to you with complaints of mass in the testis, orchidectomy was performed, and this is the image given below, what's the diagnosis? If this image is given below, then the diagnosis is seminoma. And if the question is asked, which testicular tumor is having best prognosis, it is yolk sac tumor. So yolk sac tumor, it is having best prognosis. So guys, anybody remembers the exact question? It's the yolk sac tumor which is having best prognosis. Right? So guys, it depends. I'm telling you both options. Suppose the question is given and image is given. If this image is given and a young adult is mentioned and diagnosis was asked, it is seminoma. And if the question is asked that which testicular tumor is having best prognosis, so the testicular tumor with best prognosis, that is yolk sac tumor. Okay, so different image was there. This image was not there, some different image was there. So in that case, the correct answer would be yolk sac tumor, because it's the yolk sac tumor which is having best prognosis. So best prognosis, it is seen in yolk sac tumor. Suppose yolk sac tumor is not there in the option, then we can mark seminoma. Right? So it depends on the language, it depends on the exact image. Similar image was there and somebody is saying that it was the cut section of testis. So I explained both. Clear? Best prognosis, it is seen in yolk sac tumor. Next question, guys. See, lady presents to OPD 10 days after delivery with chief complaints of tenderness in the breast. What is the most likely diagnosis? Guys, tell me. Obviously, it's not the breast engorgement, it's not the fibroadenoma, it's breast abscess. Any other thing was mentioned or not? Guys, acute mastitis was also there and breast abscess was also there. There was high grade fever. Okay. So presence of high grade fever, it is suggestive of pus collection. There is high grade fever. Fluctuation was also there. Okay. Cracked nipple was there. Fluctuation, very good. Fluctuation was there. Everything was there. Fluctuation was there. Cracked nipple was there. Fluctuation was there. There was cracked nipple. Guys, so it's clear cut case of what? It's a clear cut case of breast abscess. It's a clear cut case of breast abscess. Clear? So cracked nipple, there was engorgement, engorged. Okay, engorgement of breast was there. Breast engorgement. So it's a clear cut case of breast abscess. Breast engorgement. Breast engorgement. So it's a clear cut case of breast abscess. You know, most common organism responsible, Staph aureus, and drug of choice is cloxacillin or dicloxacillin. It's a cloxacillin or dicloxacillin for Staph aureus. So correct answer is B. Guys, next question. A patient underwent surgery for pilonidal sinus. Can anybody tell me what's the correct answer? Which type of flap is used in this surgery? Okay, guys, can you tell me? Yes. What's the correct answer? Okay, it is bilobed flap and it is looking like a leaf, maple leaf. That's why what's the other name? It is known as leaf flap. So what is the name of this flap? It is leaf flap. Yes, this is also known as bilobed flap. Clear? Looking like maple leaf. So obviously it's not only fasciocutaneous rotation flap. It's not the transposition flap. Somebody is saying that advancement flap was there. There was advancement flap. Advancement flap. Okay, so guys, let me tell you what are the flaps which are used in pilonidal sinus. We use Limburg's flap, Kerry-Daki's flap. It is Limburg's flap, Kerry-Daki's flap. Okay, one of the flap used in pilonidal sinus is rhomboid flap. So this is known as leaf flap or bilobed flap. Axial flap was also there. Okay, so there was one option, axial flap. Okay guys, the same image was there in the question or some other image was there? वन सेमी सर्कल, एक सेमी सर्कल था, स्ट्रेट लाइन नहीं था, नॉट द सेम इमेज. ओके, somebody was telling me sir it was दो लोब जैसा था कुछ, something it was like that. Okay, so bilobed flap, which is also known as leaf flap. This bilobed flap usually it is used for tip of nose. Okay, rotational flap, right? So guys, we will discuss this question. It depends on the image what kind of flap is there. By the way, for pilonidal sinus, Limburg's flap, Kerry-Daki's flap, that is used, and it's a type of rhomboid flap which is also used in the patients of pilonidal sinus. Next question. A child was brought with recurrent episodes of vomiting. Child, X-ray was done. Clear? In this X-ray, guys, can you tell me how many bubbles you can see here? Guys, tell me what's the diagnosis here. How many bubbles you can see here? Can you see? How many bubbles? Yes, it's a single bubble. You can see this is distended stomach here. The stomach is distended. So obviously it's a child. What's the problem? Most probably this child is having what? Hypertrophic pyloric stenosis. And whenever there is hypertrophic pyloric stenosis, what happens? These patients are having hypokalemia, hypochloremia, metabolic alkalosis with paradoxical aciduria. So what's the problem? There is hypokalemia. Okay, without image. So single, you have to choose hypokalemia. Recurrent episodes of vomiting, hypokalemia. Surgical technique is given in pyloric stenosis. First to correct electrolyte imbalance, yes. Okay, there is paradoxical aciduria, right? So guys, it is hypertrophic pyloric stenosis. There is hypokalemia, hypochloremia, metabolic alkalosis with paradoxical aciduria. First, we have to correct hypokalemia. And what is the treatment? We have to go for pyloromyotomy, that is known as Ramstead-Friedet. It is Ramstead-Friedet pyloromyotomy. It is Ramstead-Friedet pyloromyotomy. Okay, somebody wants to tell me that, sir, the question was, what should be corrected before surgery? In this case, what should be corrected before surgery? We have to correct hypokalemia. What should be corrected? What should be corrected before surgery? Correct hypokalemia. What should be corrected before surgery? So guys, we have to correct hypokalemia. Clear? So correct answer is A. Electrolyte imbalance, yes. Atif, Altaf Hussain, you want to say that, sir, voice volume kam hai? You people are not able to hear me? Yes, guys, should I increase the volume? So we have to correct the dyselectrolytemia first, and after that we have to proceed the surgery. Clear? Because it's a type of medical emergency, not the surgical emergency. Next question. Which of the following is characteristic of hypovolemic shock? So in hypovolemic shock, there is loss of fluid or loss of blood. So in this case, what happens? There is decreased cardiac output. That's why what happens? Yes, there is increased heart rate. So in these patients, heart rate is increased. There is tachycardia. And what happens? There is increased resistance. So what happens? There is vasoconstriction. There is increased resistance, so there is vasoconstriction. Clear? So if there is vasoconstriction, obviously there is high vascular resistance. So there is high vascular resistance. Clear? Option was decreased preload. Okay. What were the options, guys? Decreased preload, decreased venous return, Yes, there is decreased venous return. There is decreased venous return or decreased venous pressure. So obviously preload is decreased because there is blood loss or fluid loss. Clear guys? So what's the pathophysiology? There is blood loss or fluid loss. Because of that there is decreased preload. So what happens? There is sympathetic stimulation. Because of sympathetic stimulation there is increased heart rate. So patient is having tachycardia. There is vasoconstriction. Because of that what will happen? There is increased vascular resistance. So increased vascular resistance. Very good Shubham, you are correct. Decreased preload, high peripheral vascular resistance, decreased venous pressure. Okay guys, so this is the answer. It depends on the language and options. Next, a patient came to OPD with chief complaints of swelling in the thyroid region, moves with deglutition on protrusion of tongue, rupture of swelling with pus discharge. What is the preferred treatment? So guys, it was thyroglossal cyst converted into thyroglossal fistula. So initially patient was having thyroglossal cyst. It was converted into thyroglossal fistula, and for both of these what we have to go for? We have to go for cyst trunk operation. It is cyst trunk operation. Clear? So we go for cyst trunk operation. Correct answer is A. Options were different. Okay guys, so options were different. Can you tell me what were the other options? Diagnosis was asked, not the cyst trunk operation. So correct answer, it is actually thyroglossal fistula. Guys, do you remember the exact options? It was thyroglossal fistula. Okay, thyroglossal cyst changed into ulcer, one option. Thyroglossal cyst changed into ulcer. One option, increased risk of carcinoma. Yes, there is increased risk of carcinoma. Can you tell me guys which carcinoma? Papillary carcinoma. So here there is increased risk of papillary carcinoma. Okay guys, so it was thyroglossal fistula, increased risk of papillary carcinoma thyroid. No cyst trunk operation was mentioned. It is not squamous cell carcinoma. It is papillary carcinoma. Okay, one was positive acid fast stain. Positive acid fast stain. One option was incision and drainage. You should not go for incision and drainage. Okay guys, so let me tell you, it was thyroglossal cyst which was converted into thyroglossal fistula. Long duration thyroglossal cyst increases the risk of papillary carcinoma. What's the management here? We go for cyst trunk operation. It is going to increase the risk of papillary carcinoma, not the squamous cell carcinoma. Clear guys? Next question. A patient is brought to emergency with history of fall. CT brain was performed. What is the best option? Guys, the same image was there. You can see here. The patient is having a contusion and the patient is having what? EDH. The same image was there or some other image was there? Okay guys, what kind of image was there? Do you remember? It was SDH or EDH? Which image? Okay, so SDH. Imagine guys, if there is SDH, what is the preferred treatment? We go for drainage. Okay, it was SDH image, not this one. SDH image. And how you drain SDH? Subdural hematoma. Preferred is go for craniotomy. Okay, so it was SDH image and treatment craniotomy. It was related to decompression or it was related to certain drugs. Okay, so it was related to aspirin and clopidogrel. Aspirin and clopidogrel. Aspirin and clopidogrel. Right, so might be related to what? Medicine question, that patient is taking anticoagulants and after that there is head injury. What's the diagnosis? Option was copious irrigation. Okay, clopidogrel and aspirin is given. One of the option was vitamin K. Vitamin K was another option. Okay, for the treatment. There was 3 hours timeline. 3 hours timeline was there. Septokinase. So guys, it was STH or it was intracerebral hemorrhage? Cerebrovascular accident was there. So most probably this question will be discussed in medicine. STH only, right? So see, if there is small STH, this patient can be managed conservatively. But if large STH is there, we have to drain it, right? Okay, in autopsy question was surgeon even after washing bleeding doesn't stop STH, right? So guys, it depends on the exact language. We will discuss this question later. Okay, you remember any other question? There was history of ischemic stroke. Somebody wants to say that there was history of ischemic stroke. Okay, guys, any question was there related to breast cancer? Question related to breast cancer. There was one image based question related to hernia. Anybody remembers that? There is image based question related to hernia. And there was one CT image in which there is lump in the kidney or hydronephrosis. Then 6th liver segment was asked. 6th liver segment. It was 6th or 8th. Okay. Then one question was there, amputation. Amputation, it's a life-saving procedure. Amputation in both limbs. Amputation किया दोनों legs का for life-saving. So life-saving procedure. Amputation. There was one cancer on cheek. Guys, anybody remembers that? Cancer on cheek. There was one swelling in abdomen. What was that swelling in abdomen? Okay, 6th liver segment. Somebody wants to say that, sir, 8th segment was asked. Okay, there was lower lip image. So lower lip image. Most probably carcinoma, and then radical neck dissection was asked. Radical neck dissection. Okay, hernia was first. What was the question related to hernia? Hernia, it was reducible. First, it was reducible. After that, it became irreducible. Irreducible. Okay, somebody wants to say that, sir, there was one umbilical hernia related question. Umbilical hernia. In lower lip image based question, tobacco was there in the question. Tobacco, most probably patient was having carcinoma lower lip. Hernia, which was initially reducible, now irreducible. Obviously, guys, in this case, which surgery should be done? We go for Lichtenstein repair. Which surgery is done? Here we go for Lichtenstein repair. So hernia, which was initially reducible, later become irreducible. Generally, it's difficult to treat irreducible hernia by laparoscopy. So Lichtenstein repair is preferred. Yes, there was onlay inlay mesh repair. Okay, onlay inlay mesh repair. Indirect hernia, most common blood vessel damage. This question was there. There was one flower vase sign. Flower vase sign, most probably related to radiology. There was inlay onlay. There was one question related to inlay onlay. Okay, guys, let me tell you about radical neck dissection. What do we do in radical neck dissection? It is removal of level 1 to level 5 lymph nodes with excision of sternocleidomastoid muscle, internal jugular vein and spinal accessory nerve. When all three are removed, it is radical neck dissection, and if any of three is preserved, it is modified radical neck dissection. Usually in MRND, all three are preserved. There was multiple renal calculi. Okay guys, what was the question related to that multiple renal calculi? There was question related to multiple renal calculi. Best incision, yes, we discussed appendix incision related question, that was discussed guys. Okay, any question related to burn and plastic surgery, fast intra-abdominal organ injury, urethral injury, bladder stone, prostate. Guys, tell me, burns, what was the question related to burns, guys? There was one question related to burn. What was the question related to burn? Percentage of burn, okay? What percentage of burn was asked? It was 36%. 36%, okay, right? Okay, guys. Plastic surgery, wound, keloid, hypertrophic scar, upper hand, chest, abdomen. Okay, upper limb, chest, abdomen. Right upper limb, left upper limb, anterior chest and abdomen. Okay, upper limb, both right and left. Chest plus abdomen is 18%. Upper limb, lower limb 18. So straightforward, it is 36. Okay, guys, it is 36. Very good. Okay, any question related to colon, rectum, anus? Colon, rectum, anus, intestinal obstruction, intussusception. There was one question related to GIST. Anybody remembers that? GIST related question. Gastrointestinal stromal tumor. Adjuvant treatment. Adjuvant treatment, guys. Adjuvant treatment related to GIST. There was one question related to, okay, imatinib. Yes, obviously imatinib. Very good. It is imatinib. There is another question related to fistula in ano. Fistula in ano. What was the question, guys, related to fistula in ano? And there was one question related to colon cancer. Colon cancer. And there was one question of cholecystectomy, in which structure was supposed to be identified. In the cholecystectomy, yes, the structure was to be identified. It was bile duct, cystic artery. GIST treatment, yes, we give imatinib. Okay, ileal perforation. There was another question of ileal perforation. If there is ileal perforation, guys, what you have to do? Whenever there is bowel perforation, first you have to resuscitate. So what you have to do? First IV fluids. So go for resuscitation, and after that we go for exploratory laparotomy. Exploratory laparotomy. Clear? So we go for IV fluids followed by exploratory laparotomy. Guys, can you tell me what was the question related to colon cancer? Colon cancer. Okay, there was one question related to pilonidal sinus opening. Guys, what was the question related to pilonidal sinus opening? There was one question related to pilonidal sinus opening. Pilonidal sinus opening. Clear? So it is going to open where? In the postnatal cleft region overlying the coccyx. Going to open over postnatal cleft region overlying the coccyx. Okay. Any other question related to esophagus? Carcinoma esophagus, peptic ulcer, carcinoma stomach, carcinoid tumor. Any question related to pheochromocytoma, intussusception. Gastric lavage is contraindicated in. Gorgeous girl wants to ask that, sir. There was one question related to gastric lavage. So gastric lavage is contraindicated in. Okay, very good. Esophageal perforation. Yes, alcoholic patient. That is Boerhaave syndrome. Guys, tell me, what was that question? Boerhaave syndrome, esophageal perforation related question was there. There was one question related to esophageal perforation, Boerhaave syndrome. Obviously, alcoholic patient with multiple episodes of vomiting. Yes, alcoholic patient with multiple episode of vomiting. Obviously, there is subcutaneous emphysema, thoracic pain. Okay, guys, carcinoid tumor. What was the question? Pradnya Sonar. There was one question related to carcinoid tumor. Can you tell me? And there was one question related to GERD drugs. GERD drugs. There was one question related to carcinoid tumor. Carcinoid tumor. Yes, carcinoid tumor. 5-hydroxyindole acetic acid. Carcinoid. Yes, obviously it is associated with increased 5-hydroxyindole acetic acid. Increased 5-hydroxyindole acetic acid. Very good. Yes, it's correct. Everybody is correct, guys. Anybody remembers that GERD related question? GERD related. Esophageal perforation related question. Suppose there is esophageal perforation, it's Boerhaave syndrome. What was the question? It was related to management. Okay, metoclopramide was there, alprazolam was there. Okay, guys, any breast cancer related question? In stomach, peptic ulcer related question, gastrectomy, dumping syndrome, types of gastrectomy, trichobezoar, peritonitis related question, spontaneous bacterial peritonitis. Okay, flask shaped ulcer in sigmoid colon. Somebody wants to say that, sir, there was one question related to flask shaped ulcer. Flask shaped ulcer. Guys, tell me, this flask shaped ulcer, it is seen in amoebic colitis. Flask shaped ulcer, it is seen in amoebic colitis. It is seen in amoebic colitis. There was one question related to hydrocele. Any question related to bladder stone, bladder rupture, urethral injury, carcinoma penis, varicocele. Treatment of flask shaped ulcer. Obviously, guys, we give metronidazole. What we had to give here? Metronidazole. Hydrocele CT was there. Okay. Air under diaphragm. Okay, guys. Left renal mass was there. There was left renal mass. Guys, there was one question. Any question related to arterial disorders, venous disorders, arterial disorders like arterial occlusion, aortic aneurysm, Burgess disease. Yes. Kidney calculus was there. Okay. Pradnya Sonar. Okay, guys. Okay, parathyroid and cystamebi scan was there. Parathyroid, again a repeat question. There was parathyroid and cystamebi scan. Cystamebi scan. Cystamebi scan. Okay, guys. Please, if you remember some more question, you can please mail the questions to my mail ID. drpritesh@gmail.com, or you can directly send those questions on Instagram only. Prostate specific scan, prostate specific antigen, miliary TB X-ray, hypoechoic mass. Okay, guys, technetium 99. Okay, guys, so please, if you remember the option, please send it to my mail ID, drpritesh@gmail.com. It's drpritesh@gmail.com. I hope that you are going to crack this exam and you are going to pass this exam, guys. So take some rest, relax, and hope for the best. The best of luck from the whole PrepLadder family. All the best, guys, and thank you very much for your participation. Thank you very much for your interaction. Okay, guys, bye and take care.